Hi everyone! Welcome to our first Facebook Live. Woo! I'm Ellen, this is Courtney.
Hello.
We are from Integrated Wellness Clinic, and today we'll be covering off some information about children's health and ADD, ADHD in the lead up to our children's health workshops in July and August at different locations, but I'll be talking about that at the end. So, what we'll get started on first off is chatting to lovely Courtney. She specialises a lot in children's health, working holistically. So, first off, Courtney, introduce yourself a little bit.
Hi.
And also, if you can give me a bit of a rundown on, in a nutshell, of how you treat or how you look at a person with ADD, ADHD.
Wonderful. Hi everyone, welcome if you've tuned in. My name's Courtney. I'm a naturopath and nutritionist here at the Integrated Wellness Clinic. Been here for a little over a year and been practicing for almost 7. And I've seen a lot of patients and families that come in with children with a diagnosis or not, just the actual concerns. And I guess the most important thing to want to share with you today is how we as naturopaths look at conditions, any condition particularly. We always look at the individual. So we're not particularly interested in a label or a diagnosis. That's great if you have one. We're concerned about getting down to the nuances of that particular person in that room on the day. So we'll always look at the scope of their entire health. We could be looking at their nutrient status, for example. Anyone that's done any research of their own might already know a little bit about the connection we know with their gut health and the digestive system and these kind of mental health conditions that we see. Detoxification and liver and the ability to have a lot of those processes working correctly can all be implicated when we're looking at children and ADD and ADHD presentations as well as adults.
So something else that we also like to work on at the clinic and like to tell people too is that even though these are the things that we work with as naturopaths, with things like working on your liver, heavy metals, all of these things, is that we look at the whole person. We never treat two people the same. So I don't think that I've ever given someone the same treatment plan as someone else.
Absolutely.
So I guess that's the difference. We also have psychologists here at our clinic, so we do like to integrate the psychologist into the treatments as well. So generally we would work alongside of the psychologist with doing all of these things that Courtney just said too. So Courtney, if you were to have someone walk into the clinic today and who were asking about ADD, ADHD, what kind of avenue would you look down first, and what would be, say, the top 3 port of calls that you would go to?
Yeah, fantastic. So we would, again, as I mentioned, look at the person. So there might be concerns from a parent about particular symptoms, particular presentations, things like the concentration in school or the behaviour at home. So we're always taking into consideration your goals and your priorities, not just looking at an ADHD box and trying to fit that person into it. So depending on those unique symptoms for that person, an individual, we might start with the nutrient status. We might be talking with your GP. We might be accessing things and tests on the Medicare rebatable scheme where appropriate, so that we have all the information such as their zinc or iron levels. Zinc, for example, is a cofactor in over 300 mechanisms in the body, particularly when we're looking at brain chemicals and conversions of proteins that we eat into brain chemicals. So something as innocuous as a zinc deficiency could be an incredibly important piece of restoring an individual's ability to make brain chemicals like dopamine for their focus and attention. Another individual might be presenting with dietary issues as well as their behavioural or concentration issues. So looking at the gut health might involve stool testing. And stool testing that we are passionate about here is very comprehensive. We're looking at microbial counts, we're looking at beneficial flora numbers. Do we have the good guys there to help make the brain chemicals? Remembering that serotonin and dopamine are produced in our guts, and over 90% of that production is happening right there. So looking at the fundamental area of our health that's actually responsible for those behavioural type issues. I mentioned detoxification and liver. So another individual's presentation may lead me to want to talk about how they detox and how they basically rid the body of things that can inhibit and hold someone back from actually feeling their best self and from focusing and concentrating. So, the functional tests that we talk about are so relative to the person that's in front of us, and we have an amazing array of those functional tests, as well as those working with GPs, to gather all the information that we need so that person gets the most individualised treatment.
Cool, awesome. And I guess also looking at going back to basics, helping children eat properly too, because I suppose we might see a lot of picky eaters in that kind of picture that we're looking at. So that ties in with things like nutrient deficiencies, but eating styles and lifestyle habits would also be a big part of
definitely
how you treat.
Yeah, and Ellen's really nailed it there in terms of looking at the diet in conjunction with treatment. So it can be, the chicken and the egg scenario. Was a child's pickiness of eating causing a nutrient deficiency which compounds the inability to make a brain chemical? Is it a genetically passed on food intolerance or sensitivity that stops a child eating certain foods, and so therefore it's actually the gut we've got to fix first to then enhance that child's ability to want certain foods in their diet, and for their palate to expand, and for their interest in foods to really blossom. So we also look at the diet as part of the lifestyle. We look at it as part of the treatment, and we always make sure that whatever requirements and specificities of that child that we know, we're going to work with them, and we're going to make sure that they're always it's something that can be followed, because as practitioners we work a lot with diet, and we know it's one of the hardest things for children to be told what to eat, depending on the age, of course. So we never underestimate how tricky that can be to navigate, and we have loads and loads of tips and tricks and information that we can always share with you, particularly actually in our workshops, which is why we run them. We want to tell all of the tricks of the trade, as much of imparting all the knowledge that we have into the community, so that you can start to make really beneficial changes, and you can sort of see that in your own household, even just from learning something from one of our workshops.
It's all those little things. So other things that we do at workshops and also in clinic, because we do stock some different kinds of products that we recommend to patients. So easy things that we do recommend are things like bone broth or veggie broth. So this is what we're drinking now.
Wish we could share it with you, but it is delicious.
So with things like veggie broth and bone broth, you can use them, you can just drink them like this, or you can use them as stock instead of using little stock cubes or things in Tetra Packs, those kinds of things that are probably full of other nasties that won't agree with kids anyway. So you can hide them in foods, you can use them as bases for soups, so many different things. So these are all of the little things that we try to get people to incorporate, and it can just be really a lot easier when you're trying to help kids get more nutrients without having to make them sit there and eat a bowl of broccoli or something like that.
Absolutely.
Cool. Well, if you're interested in coming to any of our workshops, we do have a few coming up in July and August around children's health. We're doing a couple of other ones. So Courtney's doing a children's health workshop. I'm doing a hormone workshop in July. So have a look on the link section in the comments, because I'll post all of that below, so you can just click it easily and book your tickets. And we look forward to doing some more of these Facebook Lives, because I feel like they're really helpful for people to just jump on at lunchtime and have a listen to us ramble about different stuff. So we'll be doing different topics each week.
And if you have any suggestions for a topic, or you have any questions, we'd love for you to pop it in the comments. We're always happy to share as much knowledge as we have with you about the things you want to know about.
Yeah, cool. But have a great day.
Awesome.
See you soon.
Bye for now.
Bye.